Now in golden hour, every minute counts. I always remember the neonatologist when they say that every second counts them when they are resuscitating the neonate. Don't you think that every minute is important for us? Yes, it could be even an uneventful delivery, which can lead to acute morbidity, which can lead to SAM, that is severely acute maternal morbidity, or a near miss situation. And if we have not acted in this hour, that is the golden hour, can lead to maternal mortality. And that is the importance of golden hour, that once the PPH is diagnosed, every minute counts. Because if we have anticipated, then we are already prepared, but it can happen in sometimes where we have not anticipated. So what is postpartum hemorrhage? Is predict, prepare and handle. So there are certain conditions where we predict, but we have to be prepared all the time, and once we diagnose, we should be ready to handle it. Now, atonic PPH is the most common cause of postpartum hemorrhage, and the uterine blood flow at term is almost 700 to 800 ml per minute, and the uterus can simply pour and lead to death within minutes. So even if we miss the time or few minutes in golden hour, the patient can go into hypotension. Even smaller blood losses matter in women with low BMI, anemia and preeclampsia, and these conditions are quite common in developing countries like even India. And in PIH, they have a shrunken intravascular compartment. So even with smaller blood losses, these patients can show signs of shock. Now coming to the prediction, these are the risk factors for postpartum hemorrhage. Like before delivery, if there is a previous history of PPH, if she is anemic, there is a history of preeclampsia, it is a multifetal gestation, there is polyhydramnias, there is antepartum hemorrhage, or there is a coagulation disorders. So these are the cases where we predict, and also cases of placenta previa, and nowadays we also see more and more cases of adherent placentas associated with placenta previa. So we should have investigated, and we should know that these are the patients who have a high risk factor for postpartum hemorrhage.